Assalamu alaikum dear doctors. In this video I am discussing about TAS case number 19, question number 3. And the question is a 14-year-old girl with chronic diarrhea and weight loss and dark brown pigmentation of her colonic mucosa on colonoscopy. So what is the cause of diarrhea of her condition? Let's read the explanation. In the third case of diarrhea, in a teenager with weight loss, inflammatory bowel disease, in particular Crohn's disease, must be a prime consideration. However, the finding of dark brown pigmentation, remember, finding of dark brown pigmentation of the colonic mucosa at colonoscopy is typical of melanosis coli, most commonly caused by extended use of laxative. Biopsy reveals pigment-laden macrophages. The brown pigment is lipofuscin, not melanosis as the nomenclature would suggest. Anthraquinone containing laxatives, in particular senna, are the most likely culprits. Melanosis coli is not uncommon finding at colonoscopy in adults. However, in the clinical case detailed here, an eating disorder must be suspected. So, the clinical presentation of celiac disease and the signs underpinning this are discussed in more detail in chapter number 18. They are telling toddlers diarrhea is the commonest cause of persistent loose stool in preschool children. The stool in these children is a variable consistency, but the presence of undigested vegetables within the stools is common. This is probably more than one cause of toddler's diarrhea, but the child thrives and therefore malabsorption is not a feature. There is increasing the fat content of the diet can improve the symptoms as dietary fat will slow the gut transit time. So, if we see on the second para, they are giving a description about toddler's diarrhea. They are telling that toddler's diarrhea characteristic feature is there is persistent loose stool in preschool children, and the stool of the children is variable consistency, but the presence of undigested vegetables. Remember, presence of undigested vegetables present in toddler's diarrhea, and the child growth is well. There is no any malabsorption feature. So that is toddler's diarrhea, and we know that toddler's diarrhea treatment is reassurance, and diet is increasing the fat content of the diet can improve the symptoms as dietary fat will slow the gut transit time. Well, now we are discussing about our question. The question, they are mentioning that chronic diarrhea, weight loss and dark brown pigmentation. So the dark brown pigmentation is the key point of this condition, that is found in laxative, and the biopsy of laxatives is present pigmented laden macrophages, and the brown pigment is lipofuscin. Here the mention that is lipofuscin. So diagnosis is laxative abuse. Please do subscribe and share my channel everyone. Thank you.